People have a stigma when they think that, oh, you're seeing a psychotherapist or a therapist and you're seeking counseling. They have a stigma that maybe it's a very negative thing. Or how can we make this more common to talk about now?
With the older generations, it's a bit difficult because they've grown up their whole lives kind of believing that it was a taboo topic. If someone said that they had depression or anxiety or panic attacks, I think they thought like, okay, this person like that word like crazy.
What is the most common kind of mental health issue that?
But I know the one that I hear most about is anxiety. A lot of people have.
What are the consequences? Like if somebody does not take their mental health seriously, what would be the consequences in the long term? Like I've heard things that, oh, I had anxiety, so that led to a heart attack. Is that something true? Like does that how mental health comes into play of our health? Hello everyone, and thank you for joining us today for another podcast. Today I have a guest who's actually pursuing her career in psychotherapy and has been related to mental health field. We are going to talk to her and see what kind of experience she has to share and what advices and tips she is going to give to my viewers. So let's introduce Sahar today. Thank you for joining us and thank you for taking out time to come to our podcast.
Of course, thank you so much.
Not a problem. So Sahar, before we get into it, let's talk about a little background of yourself and how, like what made you choose this as your career.
So I did my undergraduate in human health sciences. We do have some courses in there relating to mental health, and also during my undergraduate, because initially my plan was a little bit different, but also a lot of the people around me were experiencing mental health difficulties, like illnesses and just poor mental health. So I thought it was an important field to go into. So yeah.
So when you said you did human health sciences,
Yes.
so is that the only route to get to this career, or are there any other options that people could have done other degrees or other bachelors into and then pursue this as a career, or that's the only way?
I guess it depends on the university that you're choosing for your master's. But you could do psychology, like an undergrad in psychology. You could do human health sciences. I'm not sure, but I think you might be like you can do other like social studies as well. But you have to check, I guess, based on the university, right? Because they have different requirements sometimes.
Right. So and again, like, why did you choose this career? Because it's a very, I would say, intense career, right? Like where you have to deal with other people's problem and you have to make it your own to feel what they're feeling, and actually take care of them. So why would anybody want to choose this as a career, or what kind of passion they should have towards it to actually think of doing it for the rest of their life?
I guess the first thing would be like you have to be interested in mental health and mental illnesses, so both mental health, mental illnesses, things like that, and wanting to help people. So like if you're not interested in helping people, then you're not going to be able to do it. Like what you said, like you have to sort of really be there, be empathetic, feel kind of a little bit what they're feeling. And I guess the most important thing, wanting to help them. So like learning about mental health, like through the courses I did in my undergrad, and also from the people around me that I could see and their experiences, I really wanted to help. Like I saw them, I learned about people, I learned about the different mental illnesses or disorders, and how important mental health was, and I wanted to be able to go into counseling, to be able to be there and teach people skills that they need, or just be there for them if they need somebody to talk to, be the person that they need that maybe they're not able to find in their life otherwise, and the skills that they might not be able to learn otherwise, maybe just sort of help them learn those skills or push them towards those skills.
Now Sahar, like where we come from in our communities, even in Canada or back home where we are from, Pakistan, people have a stigma when they think that, oh, you're seeing a psychotherapist or a therapist and you're seeking counseling. They have a stigma that maybe it's a very negative thing. And how, like, can we change it, or why is that, like, or how can we make this more common to talk about now?
I think with the older generations, it's a bit difficult because they've grown up their whole lives kind of believing that it was a taboo topic, that they're not supposed to, like, they shouldn't. Like, if someone said that they had depression or anxiety or panic attacks, I think they thought, like, okay, this person, like, that word, like, crazy, which
Right.
it's not. You shouldn't really think like my opinion, you shouldn't really think like that.
Right.
But it's harder to change their minds because they've already gone through their whole life feeling like that. So I think it's a lot of the younger generations, like,
Right.
they need to speak up more about it, share more about it. The more you talk about it, the more normal it becomes, the more education people will have about it. People will realize it's not just in your head, you're not just exaggerating, it's not just, you're making excuses or you've gone crazy. Like, it's health, it's also health, it's just mental health. It's the same as if you had something else, right?
Right.
Yeah.
Right. So what is the most common kind of mental health issue that you think is out there, and what are the symptoms, or what one should do really if they're going through that? What is that most common problem out there?
The one that I commonly hear about, so I'm not sure what the most common mental disorder is, but I know the one that I hear most about is anxiety. A lot of people have anxiety. Basically, it's feeling fear. So I know
Right.
a lot of people think it's more nervousness, and I guess it depends from person to person how you want to describe it.
Right.
But I guess it's more like a fear of things, like. And even within anxiety, so there are multiple anxiety disorders. There's generalized anxiety disorder, there's social anxiety disorder. I think panic disorder, I think, also comes under anxiety disorders, I believe. I could be wrong, but I think so. So, and having panic attacks is also a symptom of those anxiety disorders, right?
Right. So is there any way we can it's again as I said, it's a stigma to go to a counselor or
Yeah.
seek counseling. Like, is there any way you think that they can be controlled, or like you would say no, the best way to go about is go seek help, talk to somebody? What are the consequences if somebody does not seek help? Right, if they do not take this seriously, what are the consequences that they can face?
So, I guess the first thing you said, so, sorry, I'm just thinking about that. It's a good question. The first step, if you're feeling that way, I guess, it's to recognize it. Like, it's important to be mindful. A lot of people don't know how to be mindful, and it might get to a point where you need to get help.
Right.
But if you're and you should, like, people around you might notice as well, and they might prompt you to go see somebody. They might try to help as well, but yeah, the best thing probably is to go see somebody. It doesn't have to be directly a psychotherapist or anybody like that. It can be your family doctor. Yeah, you go and you talk to them,
Right.
because they can actually, like, if it's a mental disorder that you have,
Right.
they'd be able to diagnose you, or they could refer you to a psychiatrist who could diagnose you. Psychologists are also able to diagnose, and then they might, tell you to seek therapy, which is where the psychotherapy comes in, right? Psychologists are also able to provide that as well.
Right.
So it would be best to seek help always, because the professionals will know, or they're trained to deal with that, whereas your family will try to help you, but they might not know how. For
Right.
them, there are resources that are available to try and support people.
Right.
Yeah.
Right. Now, what are the difference? Because I've heard two terms you've been using: mental disorder and then mental health. What are the difference between a mental disorder and a mental health issue?
So everyone has mental health, like everyone has physical health.
Right.
And just because you have poor mental health doesn't mean you have a mental disorder. Um, like
So what does poor mental health means?
poor mental health could mean maybe like if you're burnt out, you're just not taking care of your mental health, like in ways like if you have a really stressful job and you just keep going and going and going and going, right? You're doing your job, you're doing like a bunch of other things, you're just not focusing on yourself,
Right.
right?
Mhm.
But you're focusing maybe even on like your physical health and whatever. Like if your mental health is not good, you're gonna start noticing that in your physical health as well,
Right.
because that affects it as well, right?
Mhm, mhm.
They're connected. It's
Mhm.
still health, right?
Right.
It's just the part of it that maybe you don't see initially, right? Because you're the one that feels it. Other people don't necessarily see that until
Right.
it's maybe too late. Um, yeah, but mental disorders would be actually having a disorder. So it gets to a point where it's no longer a mental health problem or just you feeling mentally unwell. It's a point where you have a disorder, right? Um, so like, you know, you mentioned anxiety disorders or you know, depression or schizophrenia, or things like that. So those would be mental disorders, whereas you know, you can still be anxious but you don't maybe have a mental illness, right?
Right.
Yeah.
Right. So my next question to you would be is like, what are the consequences? Like if somebody does not take their mental health seriously, what would be the consequences in the long term? Like I've heard things that, oh, I had anxiety so that led to a heart attack, or I don't know, I got diabetic because of constant stress or anxiety. Is that something true? Like does that how mental health comes into play of our health?
I wouldn't be able to speak specifically to like if it can lead to a heart attack or diabetes, but definitely it can affect your physical health and lead to like problems in your physical health. Like yes, you could possibly develop um, like some other health problems. I can't say specifically which ones. I'm not 100% sure, but yes, definitely. Like if you're not taking care of your mental health, eventually it will show in your physical health as well. Because as I mentioned, health is it's overall health. If you're not taking care of one part of it, it's going to translate to the other. Just like if you have a chronic like disease, like if for physical health, right? Some people that I've spoken to, like they might have a chronic disorder, um, and because of that, like their mental health suffers. So now they're feeling depressed because of it, because it's just too much pain.
So you're
all the
saying
time.
it's interlinked, like
Exactly, yeah.
it's like mental health can play a role into your physical health,
Yes.
which means like if you're disturbed or you're not sleeping properly, it can relate to a heart attack or diabetes or whatever, and then vice versa. If you have had a heart attack, it can actually um, have a mental health consequence on it too, right? Like you're depressed, or you just got a heart attack, or you cannot perform the same kind of duties. Is that what you're saying?
It's possible. I'm not sure about the heart attack.
It is just an
yeah,
example.
yes.
Yeah. Yes.
Like maybe you're anxious about
Right.
getting, yeah. Like
Yeah.
I guess it depends on the person. With depression, it's a little bit difficult. It's like you can feel, yeah, you can feel depressed. You just don't have depression. Yeah. So yes.
So
like
so
more
are
mental
there
health.
are there any tips that you can give to my viewers of what they should take care of? Like what exactly, like when we say, okay, be mentally healthy.
Yeah.
What can I, like me myself or anybody, because I know a lot of younger kids or my age people are going through um, these mental health issues because inflation, job recessions, study pressures, job pressures, right? Like, what would your advice be? How to mitigate it or how to control it? What, like, some people say meditation or yoga helps. Like, what would your advice be?
Yeah. So yes. Mindfulness is usually something that's very recommended.
Right.
That's like I think one of the more common things that's recommended for taking care of your mental health. So that does include like meditations or like even if like what you said, like yoga, if that's something that relaxes you and makes you feel calm and kind of just brings you back into the moment, then maybe that's good for you. Like find something that brings you to a space where you're feeling a little bit calm.
Right.
So practicing mindfulness, like practicing breathing,
Mhm.
taking some time for yourself, right?
Right.
Like maybe including in the day like a time, like maybe an hour or however much time you have, or you can put in there to just focus on yourself in your mental health and just making sure and checking in with yourself, like, how am I feeling right now? And then acknowledging those feelings. You don't have to push them down. You don't have to, like, act on them. You just at least recognize that you're feeling this way.
Right.
And then that's also the next step. Like, if you need to seek help, like, maybe therapy is an option too. That might be one way that you're taking care of your mental health as well.
Right. Now, what are the resources that we have in Canada, like that people can look into when they're facing such issues? Like, can you elaborate on that? Is there like a helpline we can call? Is there any particular departments of the government who are actually just working on these issues?
If you're feeling like you need help, if you need it right away, yes, there are helplines that you can call. You can do a quick Google search, and they will give you like a list. Like, there should be like links that come up with people that you can call. I think, and don't quote me on this. Definitely do your own research as well. I think it's 811 that you can call for mental health and other health issues.
Mm-hmm.
But just double check before you do that. You can search it up online and see what that number is.
Mm-hmm.
And even for like if you're feeling suicidal, like if it gets to like a really bad point,
Right.
there are also helplines for that. That again, if you can, like you can search them up and it'll come there, like quick numbers that you can call. Another really great thing is you can actually text now as well, which is pretty good. So if somebody's like really like they feel anxious about talking on the phone, I think they provide texting services as well. A lot of the helplines now.
Right.
Yeah, so that's good.
So you said suicidal. Now, it's unfortunate, but I've seen a lot of students getting to that point where they become suicidal because of all the pressures. And again, we are in a society where it's very competitive. You have to study hard, to work hard, to get a job and whatnot. Do you think that that's a raising challenge in our communities and in societies? And what should we do to mitigate it?
Yeah, it's definitely a big thing. A lot of people feel that way, and it's definitely like it has happened in the past. It's always been there,
Mm-hmm.
but it's definitely an issue that we should, I guess, talk more about. I think people feel it's difficult for them to ask for help as well.
Right.
One thing that you can do, there's mental health first aid courses
Mm-hmm.
that are available for anybody to do, just like how you have physical first aid courses, right, that people do. A lot of people do them.
Right.
There's also mental health first aid courses that are available.
Mm-hmm.
For suicide specifically, there's a safe talk course that you can do.
Mm-hmm.
And so if you come across somebody who you feel like, they teach you in those courses to recognize the signs of maybe somebody who's feeling suicidal.
Right.
So you can maybe reach out to them and talk to them about it. And there's no harm ever in asking somebody, are you feeling suicidal? I think that's a misconception people have, is that if I ask, what if I give them the idea? But that's not true. You can ask. The research, like I've done the Safe Talk course as well, and they've told us in there as well that research has suggested that no, you can go ahead and you can ask them, because if you don't ask, you won't know.
Mm-hmm.
And then once you know,
Yeah.
the best thing to do, if somebody is feeling suicidal and you know that, you have to direct them to the right resources, because you might, like, that's too much for you to, like, you're not qualified to handle that, right?
Right.
Even if you've done Safe Talk and things like that, you have to try to get them to seek help.
Right.
If it's really bad, if it's an emergency, you have to call 911. And sometimes you might be facing that challenge of, this is my friend, they're never going to talk to me again if I call 911 because I'm going to break their trust. You have to think about, do I want my friend still here, or and them not talking to me, or just gone because now I've kept their trust. So you have to think about that as well.
Yeah, no, that's a big challenge, right? Like, because if somebody opens up to you,
Yeah.
and then you are in a situation where, like, what do I do?
Yeah.
I think the flip side to it is that people get overpowered, right? Like,
Yeah.
people start feeling that, oh, I discussed something with this person and now they want to take control of my life because they think these are the steps I should do. Because at the end of the day, I think mental health is when you know what's best, what is the best thing that works for you.
Yeah.
Right? And it's different for everybody. Now, what would you think that in a situation like this, as you said, you have to seek help, you have to take the right guidance. What would you recommend that, hey, this is what I think might work, and at least try it. Maybe you have tried it on some of your patients or some of the people you have come in interaction with. So any advice on that?
So like in terms of
Like if somebody's going through that, right?
Yeah.
Like if I'm in a situation where I have somebody who is going through a mental health problem and I can see it, what should I do? Like, because again, as you said, it's a trust issue, right? Like now you're breaking a trust, but hey, what can I do?
Yeah.
Because I don't, like, at the end of the day, I don't want to empower myself or onto the next person either, that hey, now I'm going to take you to a doctor, I'm going to do this, I'm going to force you to go see a therapist. That's a fine line, right?
Yeah.
So like, what do you think the proper way to mitigate or manage this situation is?
It can be hard. It also depends on the severity of the situation. But if you're not qualified, then the best thing would be to direct them to or try to convince them to see like a professional. Like if they don't want to go to a counselor or a psychologist or like anybody, right? Like any like a psychotherapist or anybody, they can go to their family doctor, right? Like at least go to the family doctor, at least tell the doctor what's going on, right? Because then the doctor might be able to convince them that if you take care of other areas of your health, why can't you take care of this area? Like why wouldn't you seek help for this if you seek help for other parts, like other issues, right? So that would be the best thing. For me, I'm not practicing yet. I'm still studying. But yeah, like my friends, I have actually directed my friend, one of my friends, to see a doctor, she got a diagnosis then. Yeah, so like I have directed them to see somebody, because that's the best thing. Like if you're not qualified, you might not know how to help them best, but again, you can still take you can access those resources that might help you help them better. It's just going to be a lot for you as well. So you have to take care of your mental health while you're doing that too. It's a bit of a tricky situation.
Right. So how, as you said, you're still studying, and you have done volunteer work in the past. What do you think, as a student of this field and as a person who has practiced in this field, what do you think that it comes down to, why the mental health is being affected? Like, and I understand there's no generic answer to this because it's different for everybody, but what would be the most common reason out there that, hey, this is the reason that nowadays this is so common, we are so openly talking about it? What would that reason be?
I'm actually not 100% sure. I mean, mental health has always existed. We are talking about it a lot more now. I guess maybe I don't know. Maybe it's just that like the newer generations are just more outspoken about it. There's more awareness about it. There's a lot of growing awareness. We have like Bell Let's Talk Day as well, and we have like weeks or days in the year as well where we dedicate that to mental health. So I guess there's more talk about it openly. So
more awareness is coming with time.
Yeah.
Do you think, because I again, this is a perception, that our lifestyles now are a reason of more of these problems than what the lifestyles for our older people was? Is that true?
It could be. It depends on each person, right? I guess we can't generalize like that. I don't know why there's an increase in it. It could be it could be anything. It could be like maybe people aren't it could be the simplest things. I know I was doing a research paper once, and there was something about like living near greenery, apparently, and affecting that. So something like as little as that. Obviously, not just that. There's multiple factors always involved, right? It's not just one small thing. That might be like the end trigger to when you realize it, but there's always there's multiple different factors that lead to something like that, right? Yeah. And it might be for mental health, like if you're having mental health problems, maybe it's a stressful environment, or like what you said, like how things are these days. Maybe people are more stressed. Maybe that's it. But yeah, I guess it depends on the person as well. And if it's a disorder, it's multiple different factors that are interacting and causing that.
So a lot of people in my circle who I know, they're mostly stressed about or have anxious about how they want to be successful.
Yeah.
What does success mean to you?
For me, success would mean achieving my goal of becoming a psychotherapist.
Right.
So successfully completing this program and then being able to practice to be able to get to that point where I can actually see my clients and help them out, teach them the skills, or at least contribute a little bit to make things a little bit better. Like maybe I'm not actually doing something, because when you're counseling, it depends on the type of therapy as well, right? Like maybe they're just doing it themselves, but at least being there, right? And somebody who they're
So you're saying you're gonna feel more successful when you are helping people rather than making that kind of money, I would say, because a lot of people nowadays have started feeling that, hey, success is if I make X amount of money, I drive a certain kind of car, I have a house. So you're saying your success means helping people out there.
Yeah, I guess money is also important to live.
Right.
But I think the most important part for me is helping people out. I actually don't know yet. I haven't done the research of how much I'll make. But yes, I do still need to survive, so I won't be free, unfortunately.
Right.
But I mostly...
But is that the only measure of measuring your success though? Like money?
No, so like for me, like it's helping people out, right?
Right.
I know for some people it's money, but for me, like that success would mean getting to that place where I am doing what I want to do, and I'm helping people, and like I feel like, maybe like that's my goal, right? So achieving my goal would mean I'm successful.
Okay. So our last question: what would your advice be to the younger generation out there, people who are facing the issue we have talked about today, or anybody who wants to pursue the career you're pursuing? What would your advice be to them?
My advice would be to so if you want to pursue this career, I guess do your research of what you want to do. Like if you want to come into the mental health field, first of all, determine what you want to do. Do you want to become a psychiatrist? So like the doctor prescribes medication, diagnosis. Do you want to be a psychologist? They diagnose, they also provide therapy. They can do research, or a psychotherapist. So solely providing the, and in Canada at least, in Ontario, providing the therapy part of it, right? If that's what the most important part of it is for you, then you go there. So you just determine what the requirements are. So for me, the requirements were to get into this program. Like I did my undergrad in human health sciences. I did my volunteering experience at Ontario Shores Centre for Mental Health Sciences in Oshawa, because usually these places require you to have some experience, either work or volunteer-related experience in the mental health field, a certain number of hours, and then just like your application and your resume and things like that, and just do your research of where you want to go, how you need to get there. Just take those steps. Like you can do your volunteering with your undergrad as well. It's not going to be too much. Like you can do depending on where you go, like Ontario Shores is very lenient about how many hours I could do during the week. They're very nice about it. Most places, if it's volunteering, are. So just doing that, doing your application, apply, and then just hear back. Probably apply to a few different places just as you would with your undergrad, and then and if you don't get in the first time, just keep applying, and whatever was missing the first time, just do that. Maybe it wasn't in a volunteer experience or something like that. Just complete those, and then you can apply.
And what about people who are going through these challenges? Any advice on them?
For people who are going through these challenges, definitely seek help. Like, I know it's scary, and I know that you might not want to tell people, or you might have that stigma, like because of how much stigma there is around it still. Like maybe your parents feel like it's not real, or it's just silly, or you're just like if you're like they put a bad label on it. Don't let that it's easy to say don't let that affect you, but just try to seek help, because like there is help out there, right? If you don't seek that help. Like there's no way it's gonna just automatically come to you, right? You can tell your family, and if you're not gonna tell your family, you can tell your friends, but your friends can only do so much, right? Especially if you're not qualified.
Right.
So you definitely should seek help. And if it's yeah, like it might be something you don't want people to know. You just like for psychotherapists, what you say, it's confidential. So they're not going to tell anybody unless there's a danger to you or to somebody else, or like there's a legal requirement. So you can talk to them. Like go ahead and just seek help. Like it's a big step, I know, but just take that step and just try.
Okay, so that's very good advice, Sahar. And thank you for taking your time out and coming and talking about this. I think it's really important to create awareness on this topic. I think there are a lot of people out there who are going through challenges and they do not seek help. So I really appreciate for you to come out here and take your time out. Thank you very much. Um, yeah, so viewers, I hope you enjoyed our topic today. It was a little serious one of mental health, but I think it is something we should all talk about. We should create awareness because, again, if you're healthy physically and mentally, that's the only way you can gain success and you can get and you can explore different opportunities in your career and in your journey. So mental health is important. We should talk about it. We should do something about it. Until next time, thank you.